Hi again, everyone. My name is Adam Manthei. I'm the president of Sky Valley Resorts in Caliente Springs, for those of you who don't know. Today I have with me Christy Harper, who is the operations manager at our resorts, and Dr. Michael Kim and Dr. Krista Kim, who are consultants for us, coming on to help us really understand how to reopen and have a safe place, a safe community to live in. So we've got some questions for them today, and let's go ahead and jump right in. Okay, guys, whoever wants to take this one, give me a summary of your initial site plan. What did you look at, and what mitigation efforts do you think we need to engage in?
So we went through the resorts and we looked very specifically at all of the areas where guests and staff are working and playing and congregating. We've made recommendations for cleaning as well as ways to use the facilities in a manner that is less risky for transmission. And that report is fairly comprehensive and is in the process of being written currently. And we will be sharing it within the next week.
Awesome.
Wonderful. Okay, so I think a lot of our residents are wondering, is Sky Valley, Caliente, and Caliente Springs, are they dangerous places to live and visit and vacation?
So after looking at Sky Valley and Caliente Springs, the major advantage that you guys have is that you do a lot of things outdoors and it's an outdoor community. And we know that to date, there haven't been any studies that show that if you're outdoors, you will catch the SARS-CoV virus. So that is good. Caliente Springs and Sky Valley are doing a tremendous job at keeping things safer by sanitizing. And so we think that it is a safe place to come. There are things that you can do to keep yourself safe, and we'll be sending those messages. There are things that Caliente Springs and Sky Valley are going to be doing, and they have been doing to keep it safer. But we do think that coming here and vacationing, you can do that in a safe manner. We're not as scared that something bad will happen to you. We're just trying to minimize transmission between family groups or family bubbles. And I think Caliente Springs and Sky Valley can do that in a very safe way.
It is true that there's pretty much nowhere where people can be guaranteed there's zero risk, but we do know that there are ways to limit that risk, and we're pretty impressed at what the Sky Valley and Caliente Springs resorts are proactively doing, and willing to put the work in to make sure that the communities are as safe as possible. And because of the location and the activities that are mostly outdoors, it really is a really good choice as far as vacation spots.
If I had to choose somewhere, I would come.
Oh, you're saying the right things to us. We like that. What are the top 5 things that any of us can do to stay safe?
I think the messaging Sky Valley, Caliente Springs have been putting out, just like everyone, from the government to the CDC. It's the common sense. If you're sick, stay home. Stay at least 6 feet away as much as you can. That's reasonably safe to do. There's wear face coverings, which helps minimize transmission.
Hand washing is very important. More frequent sanitizing of surfaces.
Okay, so what are the top 5 things the resort can do to help keep the community safe?
When any organization is looking at keeping a facility safe, there are very similar things that they need to do, and then slightly more. One is making sure that you have that social distance in your facility between people. So that may change the number of people who could come to open space, or changing the distance between people in an event or in an office, for instance. Second is the facilities can clean everything more thoroughly and more often. That really helps. Thirdly, they can also increase their communication with people so that everybody understands what's expected and what's being done. And then, if there is a problem, that people have an opportunity to hear about it quickly. Those are some things.
Yeah. And I think when their staff is sick, they have a robust policy on making sure that their staff is safe. Yet operations will continue and nothing will fall through the cracks. So
Yeah. Okay. Now, Riverside County reopened or allowed the reopening of our pools. It was one of the first, I think, amenities or activities they allowed. Maybe golf was golf. So, what can you tell us about the dangers of going to the pools? Is COVID-19 transmitted through pools? You know, we want to be safe. What do we know?
sure. So the good news is that there have been no studies that show that there's transmission through water. So water sports or going to the pool is as safe as it used to be. So I don't think you need to worry about, am I going to catch it in the water? The distancing things are still there. So, distance yourself. You don't have to distance from your family bubble, but from other people that aren't, as long as you're using common sense. Caliente Springs and Sky Valley have tremendous outdoor facilities, and the pools are all outdoors. So, worrying about am I going to catch it there, very unlikely. They're doing all the things they need to do with sanitizing and making sure that all the chairs aren't bunched together. So I think it is reasonable to say that if you want to come and swim, there's no problem there. Definitely don't wear your mask in the water. That's not silly. That's safe. That's pretty silly. But as long as you follow kind of common sense rules, I think it's reasonable to say that swimming, at least in the smaller sizes for now, and that as they reopen, it'll get bigger and bigger. But I think there are plenty of pools here and plenty of time where you can enjoy that.
Yeah.
Can I add something?
Sure.
So, really, the risk of transmission is not from the water itself, but from other people. So, if you were in a pool, you still want to stay 6 feet away from each other. And then it's more of an issue outside when people are socializing. And so, because of that, in order to protect yourself, we would recommend that you still maintain that distance between yourself and people who are not in your specific bubble.
So you guys have covered this just a little bit, but what is the safety difference between indoor and outdoor activities?
So the difference is that we know that the virus, basically the formula is how much virus is there and how long is it there for you to get enough exposure so that it overwhelms your body and it starts infecting you. So enclosed spaces with poor ventilation, the longer you're there and the more people that are there, the more virus particles, you're going to get a higher chance of getting infected. Not a 100% thing. Outdoor, very good ventilation, you can distance well. So virtually, I don't want to say nothing is guaranteed in life, but unlikely. Play the lottery first. Then that's the risk, so don't play the lottery. But virtually outdoors, if you do it in a safe manner, in a very common sense way, then the risk is really low. So Caliente Springs and Sky Valley have a lot of outdoor amenities and things. So I think there's a lot of things that you can do rather than if you went to somewhere where it's primarily one building indoor and that would be a little bit higher risk.
When I do activities, I like to do it with friends. I'm a social guy. People that know me know I'm a social guy. Can you talk to us about how we can engage in activities safely with friends?
One of the real difficulties with having the stay-at-home order has been for our people who either live alone or who have minimal ability to go outside their home, especially if they're in high-risk categories. They've been fairly frightened to do this, and it is good to be cautious. But this extended period of isolation is really wearing on a lot of people, and it's difficult to maintain your mental health and your physical well-being while that isolating. So I'm advocating an idea of expanding your little isolation bubble to include a few other people. If you are a high-risk person, you'd want to make sure you were including people within your small bubble that didn't have tons of outside interactions. So, for instance, do not include me in your bubble because I see dozens of patients every day, some of whom are sick. So, I'm a little more high risk to bring something into the bubble. But if you are forming forming your bubble with other people who have been fairly careful and don't have a lot of outside interactions, you have a nice low risk group. And so that allows you to bring some people together and socialize a little more, get out of the house together, go to horseshoes together or bocce ball or shuffleboard, all the other activities, going for walks together, even possibly meeting together in your home. If you can maintain that sort of intact bubble for your group, even if you're high risk, that's a fairly low risk group to put together. So for a lot of us, we're looking at, another year of trying to be careful. And so putting some thought into that and forming a group that you can socialize with, especially if you live alone, is smart for your long-term, overall health. But then again, you want to keep that group small and you want to keep that group stable. You don't want to form one group one week and a different group the next week, right? So pick carefully people that you can tolerate for a long time and enjoy. But I think that'll allow our people, especially those who are, a little more vulnerable or in a higher risk group, to actually get out and enjoy a little more and socialize a little more in a lowest risk possible way.
I was always told that forming cliques is not the thing to do, but it sounds like there's actually now a medical reason to form a clique.
There is a short-term recommendation for clique formation.
Cliquishness.
Yes.
Prescription of cliquishness.
Yes. But you are please socialize diversely online. Okay.
There you
Yes.
go.
And I do think that if you go out to the outdoor areas, you can have two bubbles socially distanced, so they are interacting, but they're not touching and hugging. That is for your own little bubble.
Yeah.
So because I have some friends are complaining that I don't see people, and the next step is you can go out and I said go have a picnic with your friends, just stay at least 6 feet away, and you can still talk. And I understand the touch, the hugging is not there, but at least it's more than just a Zoom, because we all know that Zoom is tough. And
Zoom has its limitations, for sure.
Yeah.
It's not it's not face to face.
yes,
It's not the same.
It's not the same.
Yeah.
Okay.
So my father, Tim, who many of our residents know, has hired you for his direct primary care. Can you tell us a little bit about what direct primary care is and the advantages of it?
Yes. So direct primary care is a form of providing primary care in a model where we basically work for our patients. In the usual system in the United States, we work for large organizations that contract with insurance companies. So we answer to organizational directives, we answer to what the insurance companies say we can and cannot do, and the patient ends up being down farther on the list of people whose interests we are serving. This is not why almost any doctor went into medicine. We want to actually take care of our patients. We want to meet their needs and do what's best for them and be able to respond when they need it quickly and in a way that makes the most sense.
So, and I think for your father, what made sense was we go on a month-to-month contract. We're not yearly. We're not part of a large insurance corporation where you have to fill XYZ criteria. And so while he's here, he's able to access more care because we are able to see him same day or next day. He can text us, he can call us. And so we coordinate with his physician. I even talked to his physician the other day up in Michigan. And so, there's, I guess, total wraparound care. And that's kind of where Sky Valley wants to keep you safe from whether you have your own physician here or you don't. They put together options where if you have nowhere to go, there are options rather than just the emergency room.
All right, well, thank you very much, guys, for talking with us today. We really appreciate it, and we will be trying to do these videos maybe we'll go bi-weekly, which isn't twice a week, it's every other week, to help keep you guys informed of what's going on, all the changes that are still rapidly happening to laws and protocols. Thanks a lot. Take care.